Hello everyone, I am Dr. Ramya Bandi, Consultant Pediatric Neurologist working at Ankura Hospital for Women and Children, Hyderabad. Today we learn about how to do first aid in a seizure. As you all know, you can face this problem anywhere. Your neighbor can have a seizure. As a parent, you might have to know how to tackle a seizure. Or you might be just a bystander standing in a bus stop or somewhere outside where you might face such a situation with a person having a seizure. So first let us know how to identify a seizure. There are many types of seizures, but routinely what we come across or what the public knowledge is that the person will have uprolling of eyes and then have some frothing from mouth and have some tightness or some jerky movements of the limbs. This is the general understanding of a seizure. But in some cases, the symptoms might not be so much seen or might be different. Best example is a focal seizure, wherein the person, you might not see much of a jerky movement or something like that, but you will definitely notice a change in his behavior and the level of awareness or the level of response that he was having, or he was having a few minutes ago and now he has suddenly lost he or she. That also accounts to seizure. Coming to first aid, what we have to do in case of seizure. First, you have to stay calm and then assess the situation. That so much so works out with any emergency situation. Then you have to make sure that the person or the child is transferred to a safe position or a safe place. Meaning, suppose let's say the child or a person is having seizures on road. So he or she should be carried away or moved to a safe place where vehicles are not there, etc. And or if the child or a person is about to fall off of the stairs because of the seizure, then you have to move or relocate the person to a safer place. Then you have to remove any surrounding objects which are sharp or which might cause harm to the person. So these are the main first things that you have to look for. Then the exposure, meaning if generally the children tend to be covered or the mother might be carrying the child, you might have to just see what the child, just expose the both upper limbs and lower limbs to see as what the child is doing, to have an idea of what is going on. Then you have to remove anything which is tight or blocking the breathing around the neck of the person. So any tight ties or any tight clothing around the neck should be loosened up. So after you have placed the person comfortably on the floor, then you gently try to move the person to one of his side, and you try to place some pillow or some whatever jacket that the person is having below his head, so that there will be support to his head. Why is this side position important? Why it is important? Because there will be some amount of frothing that I have already told you. They tend to get pulled up in the mouth and cause obstruction to his breathing. So by this position, all that food particles or whatever the person is having, the frothing or the saliva that the person is having will just fall to this side because of the gravity, and then the person will be able to breathe well. So that is the main thing that you have to remember. After doing, if possible, you have to time the event. With your watch, you can time the event as to how much time is the person having the seizure. Generally, majority of the seizures last less than 5 minutes. They tend to recover on their own. So after the jerking has stopped, wait patiently by the side of the person till he regains his consciousness. So that is about the first aid of the seizure. The next important thing is what you should not do during a seizure. That is also extremely important. So you should not put or insert anything into the person's mouth. That is very, very important. Many times we have seen people pouring some water or putting their fingers into the mouth or putting some hard objects into the mouth of the person who is seizing. the force generated because of the jerking of the mouth is very high, and if you put your fingers, they might get cut as well. So you should be very careful. Or any hard object, if you put, the person who is seizing might injure his tongue or his teeth. So never put anything inside his mouth. And if you pour some water thinking that the person might recover, the water will instead obstruct his breathing, which is very dangerous and not at all advisable. So refrain from putting anything into the person's mouth. And also don't restrain the movements of the person. Suppose, let's say this person is having movements like this, you should not try to hold it very hard and restrain them. For a reason, you know the person is seizing, and you know that they wouldn't stop even if you hold them very tightly. Instead, they will injure the person. I remember one scenario wherein an adult patient, the attenders have sat on his lower limbs. We do see incidents wherein the person is restrained so strongly that even fractures have occurred. So you shouldn't be restraining the person who is seizing. You just have to patiently wait till the seizure subsides. The next thing is, we should not run around to grab objects to get to the person who is seizing. Instead, we should stay beside the person. Many a times we have heard that persons will be roaming, whoever is there will be looking around for keys. Some people also have this belief of putting onion or chappals, etc. They don't have any scientific evidence, and these are all misconceptions that they will stop seizures. So instead of going around and getting all those things, you should never leave aside the person or the child who is seizing. You should be attending that person and not grabbing these things which don't have any scientific evidence. As I told, generally the seizures will subside on their own in less than 5 minutes in majority of the cases. In case if that is not happening, you can call for help and ambulance to further manage the seizures. And if the child has already stopped seizing, wait for his recovery and then take action accordingly. Depending on the child's condition, your doctor might prescribe you a medication to stop the seizures at home. Various medications and various routes were prescribed previously, but now the most common one which is prescribed is midazolam nasal spray. Strictly under medical guidance and supervision only, you should be using this. I will demonstrate how to use this midazolam spray at home when the child is seizing. Your doctor might have told you the duration that you have to wait and when to give sprays, in what type of seizures you need to use sprays. So this prerequisite knowledge is very important to further use the spray. As I told you, the first aid will be the same for any person or a child. Suppose after the stipulated time, if the child continues to seize and your doctor has already prescribed your midazolam spray, I'll tell you how to use it. From the lateral position the child was lying, try to maintain a little elevated position like this, or you can make the child, if possible, sit as well. This is a sample spray that I am showing you. Always open this cap before spraying. Many a times I have seen parents, because they are tensed, they forget to open this, and then spray one spray into the air just to make sure that the spray is working like this. The child who was in lateral position, you can elevate the child's position like this to an angle, because the spray is designed to go only upwards. So when the child is lying, you can't give the spray like this and the puff will not work. So you can make the child a little elevated position, and the number of sprays that needs to be sprayed in each nostril would have been told by your doctor, and sprays those number of times those sprays into the nostrils of the child. Then you can rub the nose like this here, and then again make the child lie down to his side. So like this, the spray can be used as a first aid only after your doctor has prescribed it. So this is how you have to do the first aid in case of a child or a person who is seizing. Thank you.